Down syndrome is a genetic disorder which occurs when a person has a full or partial extra copy of chromosome 21. This additional chromosome creates physical and developmental challenges for the person diagnosed with the condition. While the exact cause of Down syndrome is unknown, it is understood to mostly be caused by an error in cell division during a baby's development in the womb. The only confident association of an increased chance of having a baby with Down syndrome is with the mother's age. This is attributed to the fact that mothers over the age of 35 have older eggs, leading to a greater risk of improper chromosome division. However, it is important to note the majority of babies with Down syndrome are born to mothers younger than 35 years old. This is because there are many more births among younger women. According to the CDC, in the United States, about 1 in 700 babies are diagnosed with Down syndrome each year. In other words, Down syndrome occurs in about 6,000 babies, making it the most common chromosomal condition in the nation. In this video, we are going to discuss the different types of Down syndrome, common treatments, and the people who are diagnosed with this condition. There are 3 types of Down syndrome. Each type is defined by the unique genetic variation of chromosome 21. A person diagnosed with any type of Down syndrome will still have the same physical features and behavior patterns. Trisomy 21. This type accounts for 95% of all people with Down syndrome. This type is defined by each cell in a person's body having 3 separate copies of chromosome 21 instead of the typical 2 copies. Translocation Down syndrome. This type affects about 3% of people with Down syndrome. This occurs when a full or partial extra copy of chromosome 21 is present, but it is attached or translocated to a different chromosome rather than being a separate chromosome 21. Mosaic Down syndrome. This type affects about 2% of people with Down syndrome. This occurs when some of the person's cells have 2 copies of chromosome 21 and other cells have 3 copies. The presence of some typical cells causes less pronounced physical or behavioral abnormalities. Regardless of their similarities in appearance and behavior, each person diagnosed with Down syndrome has different impairments, ranging in severity. Most people with Down syndrome have some type of developmental disability, affecting their language or memory. In addition to that, some common physical features, according to the CDC, include a flattened face, almond-shaped eyes that slant up, a short neck, small ears, small hands and feet, small pinky fingers that sometimes curve towards the thumb, poor muscle tone or loose joints, and a shortness in height. These physical features can cause other health problems, including hearing loss, obstructive sleep apnea, ear infections, eye diseases, and heart defects. Down syndrome can either be diagnosed at birth or while the baby is still in the womb. Physical examinations are the primary way to diagnose Down syndrome at birth. Diagnosing Down syndrome while the baby is still in the womb can be conducted through a screening test or diagnostic test. Screening tests consist of blood tests and ultrasounds. They are the best at estimating the chances of a baby having Down syndrome, but cannot provide a definitive diagnosis. Only a diagnostic test can provide definitive results. These tests are facilitated by examining the placenta, blood from the umbilical cord, or amniotic fluid. The test can identify any changes in the baby's chromosomes. Diagnostic tests can be riskier for the mother and the developing baby. There is no cure for Down syndrome, and those diagnosed with the condition are affected by it throughout their entire lives. Speech, occupational, and physical therapies help people with Down syndrome improve their physical and intellectual abilities so that they can live the most fulfilling life. To help conclude this episode, I'd like to introduce Al Peel, PATH FVCT's Fathers and Families Support Advocate, and whose son is diagnosed with Down syndrome.
Each person diagnosed with Down syndrome have unique challenges and talents. While a decrease in cognitive function or even Alzheimer's is common later in life, people with Down syndrome often live an active and meaningful life nonetheless. Happiness and personal success are not just possible, but plentiful.
Thank you for joining us, Al, and thank you for helping us develop this episode's script. This video is brought to you by PATH, Parent-to-Parent Family Voices of Connecticut. In addition, we'd like to credit the Centers for Disease Control and Prevention, the CDC, the Mayo Clinic, the National Down Syndrome Society, and the National Institutes of Health. If you'd like to stay in the loop, subscribe to our YouTube channel and follow us on Facebook, where you'll get updates on future episodes and other programs. Thank you.